Hello friends, today's discussion will be on hemoptysis. Friends, hemoptysis is a symptom which causes anxiety in the patient family, and this is very natural. If a person is vomiting or coughing out blood from the mouth, family members get anxious, they become worried that from where this blood is coming. So I thought today I'll tell you how we approach a patient with hemoptysis, how we diagnose the causes of hemoptysis. See, patient when they come to us, when they come to doctor has to take the history of the patient. Today I'll tell how patient has to give the history, how patient has to talk with the doctor, what are the information doctor need to diagnose the case. So we need help of patient and patient family members. They have to give us the proper history. They have to tell what are the information we need. So first of all, patient has to give the history. History means everything about the patient, whether the patient is having any medical illness like hypertension, diabetes, HIV or any other disease. Patient has to give the history of any medical illness. It can be some other disease also, it can be some psychiatric illness, it can be hypothyroidism or hyperthyroidism, it can be related to some other organ. So patient has to give the history of any medical illness. Then any surgical illness, whether the patient had chronic pain abdomen or any history of cholecystitis or gastritis or something else in the abdomen or maybe somewhere else. So patient has to give the history of surgical illness. Then other history, like patient has to give us the history of any intake of drugs. If drugs means here I mean medicines for any other disease. So we ask whether the patient is taking any medicine already. That is important. Then any other like if the patient is a female, then menstrual history is important. So these are the histories, and we ask history of allergy, history of occupation of the patient, history of any smoking, alcohol intake or any drug intake, and any other habit of the patient. We take the history of the patient. Now after that we examine the patient. See, here we have to be very careful in examining the patient. If we can start from the above, like we examine the upper respiratory tract, which means nose, throat, mouth and all. So we examine that. We search for any bleeding site from the nose and from the mouth, like if there is any ulcer inside the mouth, if there is any history of trauma, then denture, we examine the denture. So examining the upper respiratory tract is important because if there is any lesion outside the lung and bronchi and we just concentrate on lung, that we miss the diagnosis and there is delay in treatment. So first of all we examine the upper respiratory tract, then systemically other organs, cardiac examination, lungs examination, then other general examination and all other systemic examination also we do. So first of all examination, now come to investigations. So to start with, we we practice respiratory system, and the patient comes with hemoptysis, so we ask for chest X-ray, PA view. X-ray is must, this is very important. Then other blood investigations like complete hemogram and coagulation profile. These two are primarily very important. So after getting these basic three investigation, we can suspect something and we can proceed for treatment, or we can proceed for the next level of investigation. Okay, the next investigation is CT scan of thorax, but this should not be the first investigation. First, we have to do the basic investigation, then according to that we can do the CT scan of thorax. By doing this, we can specifically diagnose the disease with more accuracy, and we get the extent of the disease in detail. So this CT scan of thorax we do after the chest X-ray PFU if it is needed at all. Next is bronchoscopy. As you all know, bronchoscopy. Already I have done a video on bronchoscopy. Though it was a small video, I have tried to give some basic information. Anyway, so bronchoscopy is important when the cause is not known after doing all this investigation. When the cause is uncertain, we go for bronchoscopy to see the site of the bleeding and to know the disease also. You can see the inside of the lung, so bronchoscopy is done for that, and rigid bronchoscopy is recommended for massive hemoptysis cases for treatment purpose. And lastly, bronchial arteriography, which is advised to know the bleeding site and to do bronchial artery embolization. So friends, this is the protocol how we approach to a patient with hemoptysis and how we reach to the diagnosis with the help of investigations, history and examination of the organs. Friends, that's all for today. Thank you for watching this.